Welcome back. We are keeping an eye on your health, and local experts are sounding the alarm about a disease with very similar symptoms to
We're
COVID-19.
talking about Lyme disease. It is not always well understood. The tick-borne illness can pose a serious threat, and experts worry it could even be making people more susceptible, more at risk, as many of us head outdoors to enjoy the summer months. Joining us live to talk more about Lyme disease and the risks in connection to this era of COVID-19 is Dr. Melanie Stein, the medical director with the Restorative Health Clinic. Good morning.
Morning. How are you doing?
Doing well. How about yourself?
I'm doing good.
I'm excited to get into this topic. I think it's something that a lot of people need to be aware of if they're making outdoor plans this summer. First, let's just kind of touch on what exactly is Lyme disease.
Yeah, Lyme disease is a bacterial infection that is transmitted by ticks. It infects the whole body and our blood and our organs, and it can cause lifelong debilitating symptoms if not caught quickly.
Yeah, and so, as people are trying to get more outside during this pandemic to maybe
Right.
socially distance,
One of
it's
the only things we can
one of the
do.
only things we can do. The risks obviously go up. So you kind of just touched on that, but specifically, what are the risks of this tick-borne illness?
So, here in Oregon, we have a species of the deer tick called Ixodes pacificus. That is the tick commonly known to transmit Lyme disease. Although the risk may not be as common, say, in the East Coast and in the Midwest, we do see cases here. And most recently, I have been seeing, 1 to 2 acute cases a week in my practice.
Wow. Has that been an increase in what you've seen in years past?
It has been, I would say the last 2 years, I've seen an increase in cases, and this year's by far the most.
Okay,
Mm.
that's concerning. So,
Hmm.
what should people be watching out for? What kind of symptoms? What should be setting off alarm bells?
Yeah. I think in general, I advise people after a day in the woods or even on the beach, the ticks love to live in the tall grasses on the beach, to tick check. Not always do people get what they call the bullseye rash, which is, it looks like a bullseye, but it's not as common as people think. So if you just spend a day in the woods and you have symptoms, flu like symptoms, headache, nausea, body pains, muscle ache, and fever, I would say, my clinic, I have a 48-hour policy to get you in, but in general, look for a Lyme literate physician because you need to treat this aggressively if you catch it at first.
Right. Well, I know when I was little, I got ticks from our dog. So
Hmm.
check your animals, I would assume too. And then, what are some ways we can protect ourselves? Are there good sprays out there that can ward off these ticks?
Yeah, there are. I recommend essential oil sprays. There's a couple different companies that sell tick essential oil sprays, especially with thyme and citronella and things like that. But also, if you're going hiking in the deep forest, avoid sitting on brushy areas, wear long sleeve pants and socks and a hat. And then, the biggest thing is tick check. Look, because we don't think about it. And the tick, which is active right now, is actually the size of a dot of a pencil if you were to just take the pen or pencil on a
Mm,
piece of paper.
Oh my
So it's
wow.
gosh. Okay.
possible to
Need to
remove
take
correct.
a magnifying glass to some nooks and crannies
Right.
then, because that's concerning. So if we find a tick that we think could have Lyme, is that something you can try to, should you hang on to the bug itself? Should we try and do anything with it?
Yes. So if you find a tick, remove it correctly. What you want to do is carry tweezers with you when you go hiking. Don't burn the end of it or put rubbing alcohol on it because that actually causes the tick to burrow in deeper. What you want to do is you want to lightly grab the tick with tweezers as close to the body and to your skin as possible and just gently wiggle and move out, trying to remove the whole tick. And then what you do is you actually save the tick and you can mail it in. There's two different companies that I recommend in my practice, Ticknology or Tick Report, and send the tick in to get tested to see if it does have tick-borne disease.
Oh, wow.
That's a good
Yeah.
way to kind of put your mind at ease
Oh,
then.
well, because I mean, there
Yeah.
can be some pretty big consequences, because Lyme disease can leave your body, your immune system compromised. I know
Yeah.
there's been connections with Parkinson's disease, so it can be really dangerous.
It can be, my practice is 100% almost all chronic Lyme disease where my patients have lifelong debilitating symptoms. And, it can be a very devastating disease if not caught quick. But when caught quickly, it's pretty easy to treat.
Yeah.
Okay, that's some good news. And yeah, motivation, especially in this era of a new pandemic where you do not want to be immunocompromised.
No.
Yeah, to be catching it quickly. All right, Dr. Stein, thank you so much. We appreciate the information, and have a good summer. Stay healthy.
You as well. Thank you.
And if you want to learn more about Lyme disease, or you have some questions for Dr. Stein, we will post a link to the Restorative Health Clinic's resources on coin.com.
Yeah.